Oh, there it goes. There it goes.
All right, welcome everyone. Thank you for joining us for our October All Hands on Deck. We're glad to have you guys here. Today we wanted to share some information about our organization and some other things too, but start off with some of our, hit the right button here. There we go. Start off with some of our trainings, publications, and resources that we have. I'm Carrie Jensen. I'm with the National Alliance for Drug Endangered Children, and I also have Eric Nation with me today, and also our Executive Director, Scott Henderson. So we're all here representing our group today, but we wanted to share some information and give some reminders that maybe you might not have remembered or things that maybe you just might not be familiar with about National DEC. So just as a reminder, our vision is 100% healthy, safe children, families, and communities free from the negative impact of substance misuse and drug activity. And we know that 100% is a lofty goal, but we want to strive for that because we want all children, families, and community across the nation to be safe and to be in good places. We don't want any child, grandchild, niece, nephew to be left out and to be falling through the cracks. We don't want one street in a community to be kind of forgotten about just because it might be too hard. We really want to strive towards that goal for everyone to be included in that safe and healthy environment. So in order for us to do that, we really want to train and educate people on how to change the trajectory of children and families and their communities. And so in order for us to reach that 100% vision and to change trajectories, we provide training and technical assistance. And I think many of you are familiar with that and know of the things that we offer, but we just wanted to provide some of those reminders to you so you're aware of that. This is our training catalog at a glance. These are some of our most popular or requested trainings that we have. And I think Scott's going to be able to share a link to this in the chat. So you can read the descriptions of each of those trainings and see what the links are of each of them. They do come with a fee. So in order to get the pricing that you would have for any of these that you might be interested in, then just contact us at our email at info@nationaldec.org, and we can help you with the pricing on that. They're going to vary based on if it's an individual session or an academy, if it's virtual or in person. So there's just several factors that go along with that. So contact us for pricing and we can provide more details and more information on each of those. We wanted to give you a kind of a quick overview of our trainings so far to date this year. So this year we've provided 90 training sessions with over 2,500 attendees at those sessions from the 29 states highlighted in yellow there on the map. So feel like we're doing a pretty good reach across the nation. We were also able to train 50 new DEC certified trainers in the curriculum that is just helping the reach and helping the mission grow and spread in more places than our 4-person staff is able to reach and get to all the time. As part of our trainings and our registration, we do a pre-training survey, and we had nearly 1,200 pre-training surveys completed. This kind of shows the different disciplines and attendees that were participating in the survey and in our trainings. So we get a good representation of different disciplines participating. We also, as part of our pre-training survey, ask attendees about their knowledge of drug-endangered children before and after the training. So you can see that after the training, we've helped increase knowledge by almost 2 full points. So we feel like that's good, that we're providing some good knowledge and good education there. 97% of attendees would recommend the training to a colleague, and 94% would be able to apply the knowledge that they learned from the trainings. If we break our trainings down just a little bit and look at our 2 academies that we currently offer, the DEC Academy 101, Developing Foundational Knowledge, is a 5-session academy that runs 2 hours for each session. 98% of attendees would recommend the DEC Academy 101 to a colleague, and 94% would be able to apply the knowledge learned from those 5 sessions. And then our DEC Roadmap and Toolkit Academy, that is 7 sessions long, 1 to 2 hours for each session, really focuses on building a community DEC alliance and providing the templates and tools and supports that community needs to start to implement a DEC alliance in their community. 100% would recommend the Roadmap and Toolkit Academy to a colleague, and 100% would be able to apply the knowledge learned from that academy. And that's something that's a very different focus that we are providing a lot of hands-on support from our staff with that. So we're glad that people are being able to feel positive and feel hopeful about building their DEC alliances after that academy.
Harry, can I ask a question on behalf of the audience? And maybe Eric, this is something you could elaborate on. Tell the group what it means to be a certified DEC trainer.
So in order to become a certified DEC trainer, you can get certified in our core DEC awareness or our DEC awareness training and our DEC approach trainings. In order to qualify for those, to be a qualifier for those, you have to have had either the DEC awareness training done or been present, and we have to have certificate and documentation of it and of the DEC approach as well. But once you're certified, then you can teach DEC awareness and DEC approach in your communities, or you can work with your state alliance and teach within your state or your region. It does not certify you to teach nationally. It is just for your local community or your region, or if you work with your state, you can teach throughout the state if you have a state alliance.
And a certified trainer is a 24-hour training course. So just being aware of the length of that too. All right, thank you both. Let me flip back ahead. Another training that we offer is a national conference, and we do this every 2 years. So this was the year that we held our 17th National Drug Endangered Children Conference. We held it in August, and it was in Kansas City, Missouri. We had 5 plenary sessions, 30 breakout sessions, 400 attendees, 49 speakers, and 41 states represented there in yellow were at the conference. And through our evaluation and gathering feedback after the conference, asking about the satisfaction of the conference, 96.5% of the attendees said that they were satisfied or very satisfied with the conference. So again, we felt really good about that and felt good about the partnerships that we had on this conference to be able to bring this together. And for all the attendees that were able to be there and be supportive of that also. One of the activities that we did at the conference is we had the attendees write the name of a drug endangered child that they knew of or had worked with on a paper hand. And then we individually pinned each of those hands up on a screen that became the backdrop for our plenary session. We had nearly 1,200 hands representing children that had been identified and helped through your efforts, through your boots on the ground, working with people in your community. Those are the names that you guys were able to put up there. So thank you for all that you're doing for all of these children that were listed up here and so many more. You guys do this on a daily basis to intervene on behalf of children and families. So thank you so much for all the work that you're doing all the time. Some more of our training information for you to be aware of that you can access on our website. If you go to our website, nationaldec.org, go to our training and TA tab, and then down to the online training. This is where you can find our free trainings. These are free to anyone to access, that they can go on and do. They're self-paced, do it in any time that is applicable and available for you. We have micro courses that run anywhere from 3 minutes to 15 minutes long. And then we also have 4 interactive online training modules that are 30 to 45 minutes each. Let me tell you a little bit more about the online training modules. You can see the topics, titles of the 4 courses up above. We developed this with the COPS office, but they're available and applicable to anyone. They start off with a pre-test and end with a post-test, as you're seeing there. These courses are interactive. There's voiceovers that provide details about what's being displayed on the screen and some more information. And then participants are able to click on different topics to learn more about things that they might be interested in, so they can interact that way. There's also knowledge checks throughout each of the courses to make sure that you're understanding what the intent is behind the information that's being learned, so you're staying on topic and on task as you're kind of interacting with the program throughout. And then we also use videos of professionals and people in recovery. And so you can hear from them in the field of how it's applicable to them, what their DEC efforts are, and what's something that is applicable to their discipline and how they're seeing and working those cases. So something that's hopefully helpful and applicable to everyone. At the end of these trainings, you do get a certificate of completion. So if that's something that you need for continuing education credits, and you are able to have that and submit that for your continuing education. A little bit more about some of the resources we offer on our website. If you go to the resources tab, you see highlighted there in yellow, we have a lot of different publications and resources available. Just a few are listed here on the screen, but we have articles, we have one-pagers, we have snapshots of things, quick definitions that are applicable to you as a professional, to other professionals, or even the community members that you're working with to help them understand some of these different things when it comes to drug endangered children and the intersections with other aspects of other child welfare aspects. One of the series that we have that I think is really helpful is what you should know when working with other disciplines. It's 7 sheets long of working with 7 different disciplines. So what you should know when working with law enforcement. You can read through and become more familiar with that. If you aren't law enforcement yourself, you can understand why they do some of the things the way they do it, or the time frames that they do things in. What you should know when working with child welfare, again, understanding some of their policies and procedures. What you should know when working with service providers. So just helping kind of understand how each of those different disciplines work, because then that's going to help you work more collaboratively with them and making sure that you understand that, or you know which questions to ask them so you can understand why they're doing things that way better. So it's not a frustrating thing when working with other disciplines, but you can do it as a collaborative effort. We also have a YouTube channel that has videos from 15 seconds long to hour-long videos. We have podcast links that we have participated in, and we have a resource library that I think is sometimes forgotten by a lot of people. But we take national journals and research and try to pull that all together, things that are applicable to drug endangered children and other child welfare related type of issues, and pull those together into one place so you can search that resource library when you're getting ready for a presentation, or when you're looking for statistics, or writing a grant. And so some of that information is going to be pulled together in one place to hopefully make it easier for you as you're looking through things. If you're looking through that and you're not finding what you need, let us know and we can try to help you find that. Or if you have a great article or something from a journal that you're like, this is really helpful, that's not in our resource library, send it to us and we can add it there so it can be helpful to other people too. We also do grant partnerships. That's something that maybe not everyone is super familiar with. Currently, for this year, we have 4 local alliance grants that we're partners on, 3 state alliance grants, 1 tribal partnership grant. We are a sub-award on 2 training and technical assistant provider grants. So we love to partner, we love to collaborate and help other people. So if you're interested, as grant season's starting to approach and you're starting to think of other funding opportunities or things that you would want to be included in, let us know how we could help partner on that. We could help provide language for grants that you might be working on. We might even be able to help write different pieces of that as you're submitting grants. So let us know, contact us again at our email at info@nationaldec.org, and we can start that conversation and see how we can help partner with you and help make you stronger in the efforts that you're doing in your local areas. So while we do have a lot of tools and resources available on our website, there might be handouts or resources that aren't there that you think would be helpful. So let us know that. We might be able to develop those things through the different grants and the different funding sources we have. So if something's missing, let us know and we'll see how we can help support you. You guys are out there. Like I said before, you're the boots on the ground people. So if we can give you anything that's going to help you as you're providing hope and support to the families you're serving, we want to be able to do that. So always contact us at info@nationaldec.org. And we'll be able to do the best that we can. If we can't help solve that problem, we'll be able to connect you with someone in our network across the nation that would be able to help with any of those issues. So just wanted to give you that quick reminder of the tools and support that we offer here at National DEC. And with that, I'm going to stop sharing and I'm going to turn it over to our Executive Director, Scott Henderson.
Thanks, Carrie. That was really good. I appreciate that. So hopefully you guys can see the depth and breadth of the resources that we offer in support of DEC efforts and your efforts. Our speaker today is going to be Helen Hernandez. And I think Helen may be on with us. There she is. She has had quite a day today, you guys. So I wanted to make sure she had a chance to take a deep breath and was able to join us. But just by way of introduction, for those of you that got a chance to meet her at the national conference, she obviously gave one of our morning introductions. Helen's the director of the drug-free communities within the Office of National Drug Control Policy in the White House. She's got over 10 years in that role, and she's got her master's in public health administration, and I believe is originally from South Florida, where I am located now. So she's dealing with the Washington, D.C. winters pretty successfully now. I'm probably leaving out a whole bunch of information, Helen, but I wanted to give you a chance to introduce yourself and then provide the information to the team today.
Thank you, Scott, for that kind introduction, and good afternoon, everyone. So you know, I've been doing this for 10 years, and it's an absolute passion of mine. And I hope you can, you know, feel that through Zoom and when I speak about the program. So over 10 years of experience with a public health background, of course. I worked at SAMHSA initially as a project officer, working directly with our community coalitions on the ground. And I very much loved that job because I got to see the community coalitions and build relationships with them. And then I transferred over to ONDCP, which is a part of the Executive Office of the President, as Scott mentioned. And in this role, I oversee the program policy at a national level. And so it's a little bit different. I miss that interaction with our community coalitions, but by no means have our outcomes not spoken and touched my heart. And so that's what I'm hoping to share with you all a little bit today, a little bit about the DFC program, provide you with a very quick overview of the DFC program, but also I'm going to talk a little bit about the statutory eligibility requirements for this program, so that if anyone is interested in applying, by all means, we are seeking opportunities in which we can go into states and conduct any trainings, in which we can help build communities, and our missions line up so nicely, right? And so if it's okay with you all, I'd like to share my screen.
Yep, you're all set.
Excellent. So let's see how smoothly I can do this. Are you all seeing my slides, or are you seeing the presenter?
We're seeing the presenter.
Okay. How about now?
There, that's it.
Excellent. Let me try to minimize you all. And feel free to stop me and ask me any questions. I'm going to put our images and our video feed away for a little bit. So the DFC program, like I mentioned, sits within the Executive Office of the President. From my office, I oversee the national program, the national implementation of this program. And it's not just the Drug-Free Communities program, that's the larger program. I do speak to that one quite a bit, but the CARE grant program as well, which is an enhancement to the DFC program. We don't do this alone, though. We partner with this National Center for Injury Prevention and Control. It's part of the CDC, and they provide the day-to-day management of the DFC and CARE grant program. So they're the home of the project officers and the grants management specialists, that role I did many years ago at SAMHSA, working with our community coalitions and holding their hands through the application process from application to award to grant closeout. We have at ONDCP a contract with ICF to evaluate the effectiveness of the DFC program. Our DFC and CARE National Cross-Site Evaluation team is absolutely excellent. And one of the things that's really important to me, and we made sure to write into that contract, it's not just an evaluation of how the program is doing nationally. We want to be able to help our community coalitions, assess their data, but also help them tell their story. So there's a large portion of the work that the National Cross-Site Evaluation does is providing training and technical assistance to our community coalitions, because there's no point in collecting all this data if we then don't know how to use that data to tell our story of what our needs are or what we've been able to accomplish. And then we also partner with CADCA. They were formerly known as the Community Anti-Drug Coalitions of America. They have a new name now. I've not yet learned it. But they are the grant recipients of the National Coalition Institute. What's important to note about the National Coalition Institute is that they provide training and technical assistance support to community coalitions across the country, whether they are DFC funded or not. Okay? So if you need support, you have a community, you have an interested group of people that are interested in applying to the DFC program or interested in starting a community coalition and don't know where to begin, they can reach out to CADCA, and then from there, of course, to any of our partners. They're more than happy to support. So DFC is a little bit unique. You'll hear me say that multiple times because it sits within the Executive Office of the President, and not many grant programs are administered out of there. But the DFC program was created in 1997. With its first cohort of grants in 1998. And so this is our 25th birthday. We are celebrating this really important milestone. But the DFC program, our theory, our model is that local problems require local solutions. So from Washington, D.C., I am not going to tell any one community coalition how to address their local conditions. It's just not going to be effective. So these funds go directly to the community coalitions, and we provide you through the DFC grant the resources and the skill sets, the training, the connections, the best practices, so that our community coalitions can determine what are the best strategies that are going to work for their communities. The DFC program has two very specific goals. Those were established in the DFC program statute, but the first is to establish and strengthen community collaboration. We know, and I'll talk about my 12 sectors in a little bit, but we know that if we're able to mobilize our community, we're able to bring together people with different resources, different skill sets, different connections in our community, then we're able to be successful at preventing and reducing youth substance use. And of course, over time, the more and more community coalitions become parts of their communities, they become the go-tos in that community for anything substance use or anything youth related. And of course, that with time will help, to ensure that we are also taking care of, past the age of 18. So we funded in FY 2023 751 community coalitions. And we have DFC funded community coalitions in all 50 states and US territories. And that's about, I think it's a $93 million investment for community coalitions for the DFC program, with an additional 3 for the CARA grant program. But we're really proud of these. I always try to put as much of our DFC funding into community coalitions. And so here's kind of where they lay out. If you were to just Google DFC and CDC, you would see this map, but then you could drill down a little bit further and go to states and even click on some of these dots to identify a community coalition near you. We have some regions of the US that we're a little bit worried about. One of our, what I'm calling a priority state is Mississippi, who has only one DFC grant at this time, and they are in their final year of the grant, in their first budget cycle. So we are interested in expanding our outreach and our connections with those individuals in Mississippi. So if you can help us there, we would greatly appreciate it. A little bit about the DFC grant specifics. So the DFC grant is $125,000 per year for 5 years. And then our community coalitions, after an initial 5-year cycle, they can recompete for an additional 5-year cycle. So DFC can potentially fund a community coalition for a maximum of 10 years. There is a match requirement, and I always say this because I think match scares a lot of people. Match should not be the reason your community coalition chooses not to apply to the DFC program. So what match is if you're requesting $125,000 from the grant, then you would meet in non-federal resources that same dollar amount. There are many ways and many creative ways in which our community coalitions are able to meet that match requirement. So please don't worry about the match requirement. I will say the match does increase as you progress through the DFC 10 years of funding, and we do that on purpose. We do that in order for our community coalitions to sustain their efforts. We want to make sure that once these DFC dollars are gone, that a community coalition can continue to exist and be a resource and a resource in their community. As far as eligible applicants is concerned, it's the funding goes directly to community coalitions that are 501c3 organizations. If a community coalition for some reason is not a 501c3, then they can partner with an entity who will serve as the outside organization to serve as the receiving of the federal grant award. So they serve as a fiscal agent on behalf of the community coalition. For any community coalitions that are not 501c3s and going the route of, choosing a fiscal agent, it's really important that our community coalitions and that fiscal agent choose each other, and they choose each other, and they know what the roles and responsibilities are to avoid problems in the future. So how does the DFC program define a community coalition? This is our official DFC definition of a coalition. It's a community-based formal arrangement for cooperation and collaboration among groups or sectors of a community, where each entity is meant to retain, their own identity, but come together to agree toward a common goal. And that goal is to build a safe, healthy, and drug-free community. Why do I say it's a formal arrangement? Well, it's a formal arrangement because when you apply to the program, there has to be an understanding between myself, the coalition leader, perhaps, and you, Scott, the parent sector representative, right? And so these 12 circles that you see here, they are our 12 sectors. In order to apply to the DFC program, you have to have at least 12 individuals as part of your community coalition. And I think I joined a little bit late, but I think I heard some of the work you all are doing with different sectors of the community. I think I heard law enforcement. So you all know the importance of having these folks, these sectors of our communities represented in the work we're trying to do. I'm sure many of you have heard about the 7 strategies for community change. So I won't go into details about them here, but this is the model. This is what we train our community coalitions to determine how they're going to implement their project. So these are 7 strategies for community change. We know that a comprehensive mix of these strategies will lead to positive behavior change in a community. Strategies 1 to 3 are individual strategies. They're more one-on-one. And we encourage and push our coalitions to implement 4 through 7. We want them to focus on environmental prevention strategies because those lead to long-term sustainable change in a community. We are very proud of our national cross-site evaluation and the work of our community coalitions. Our community coalitions, once you enter the program, you are required to participate in the national cross-site evaluation. And again, it's intended to measure the effectiveness of the DFC program, but I always feel it's important that the grantee is not giving us federal government data and then they never hear or see of it or know what to do with it. And also they put all this information and give that to us. I feel it important to give back to our community coalition. So our community coalitions do receive snapshots on how they are doing that are unique to their communities, coalitions efforts. But DFC grant recipients are required to submit data every 2 years on the following core measures: alcohol, tobacco, marijuana, and prescription drugs for at least 3 grades. And we focus on middle school and high school age kids. And what I'm excited to see is that we have seen amongst all DFC coalitions ever funded, significant decreases in past 30-day use for all 4 substances across our middle school and high school age kids. So I often tell our community coalitions, we are transforming communities together. In 2021, we had 67 million individuals living in communities that are served by a community coalition, which I think is amazing. And I'm very proud of the 2.7 million middle school youth that our community coalitions are able to reach, and our 3.8 million high school youth. Of course, that's not enough. And so that's also part of my motivation to put as many of our appropriated dollars into grants to communities across the country. As part of the national cross-site evaluation, I often like to say, we're not a grant-making organization within the executive office of the president, but the purpose for the DFC program existing in this space is that our community coalitions serve as a pulse check for our director, the U.S. drug czar, Dr. Rahul Gupta. And so a perfect example is we focus on emerging issues. We oftentimes hear from our community coalitions about what's happening on the ground before we start seeing it in maybe some of our national surveys. Vaping was a perfect example of that. We started to hear about vaping in communities across the country, and now, you know, a big chunk of our community coalitions are trying to address vaping amongst their middle school and high schoolers. Another benefit of our of our national cross-site evaluation is that we see best practices, right? We see our community coalitions being innovative. And so one of the promising practices we started tracking a little bit closer was this idea of community coalitions hosting youth coalitions. So before, when I started with the DFC program a decade ago, I was seeing the 12 sectors, and we had a young person sitting at the table with all the adults. And they provided their input and they provided their feedback, and, you know, the work was done. Well, what we're seeing is now that we've moved away from that, which I think is absolutely wonderful. And we're seeing our community coalitions change how they engage youth in the driving of solutions in their communities. And so they're hosting youth coalitions, and those youth coalitions are guiding the work of the adults. And so that's really important. And these youth coalitions, those coalitions that have youth coalitions, they're seeing increased youth school, youth serving sector involvement, and have a little bit more of that community mobilization going. So very exciting to hear and to see more of. The DFC program is a federal grant program, and it is a competitive grant program. And so I put this here to share that we do quite a bit of work to try to train community coalitions on how to apply to the DFC program. We do put a lot of emphasis into that. And so this website that you see on this slide, and I'll share my slides as soon as this presentation and this meeting's over. This is not what you're going to use, right, if you're interested in applying to the DFC program for fiscal year 24. But what I like about it is that it provides you with an in-depth conversation on what the statutory eligibility requirements are. It walks you through the process of how an application will be read and scored. And it really provides you, if you're thinking about applying for the program, it really helps you get started. You don't have to wait until we release the notice of funding opportunity announcement, which typically happens in late January. We're looking at early February because we're trying to find opportunities in which we can significantly streamline the federal grant application process for this program. So I like that resource. Again, it'll be updated come probably January. But again, if you're looking to get started, this is an excellent website to kind of start becoming familiar with the DFC program. The DFC program has 10 statutory eligibility requirements. And they're listed on this screen. I could go into details about each of those if that's the direction you want me to go. The other option is I can pause here and take some questions if that's, I'd like for more of a conversation if that's helpful. So let me know what you all would like to see. Any preferences?
So Helen, this is Eric from National DEC, and I have a question for you if you have a second.
Absolutely.
I appreciate you making the time to be here and the work that you are doing across the United States. And I might be able to get together with you on Mississippi. I got a couple contacts down there that might be helpful.
Thank you.
I'm just curious. I love this information, and I love the drug-free community mission. Is there any way you can kind of maybe help them make that connection with the drug endangered children in our alliances on how maybe that can blend into the DFC grants and support kind of a dual track? Does that make sense? The drug-free community and the DEC mission all hand in hand.
I think that's the reason I'm here, right? That's the reason we're having this conversation, right? It's just we, you know, when you say dual mission, we're working on parallel tracks.
Yes.
How do we bring those tracks together? Because our missions we're trying to protect youth. We're trying to take care of our communities. And so there are opportunities to do so. I think, becoming DEC becoming more familiar with our DFCs and who those are on the ground and visiting and engaging with them and learning from them is definitely a possibility. But same thing for me. I would love to learn more about the work you all do and how you all are working across the country. So I think that's what we're trying to do here. But by absolutely these, our missions just align. And so I don't want to continue working on parallel tracks. I want to start intersecting a little bit more often.
Absolutely. And I guess I would challenge the audience to maybe ask you some questions. Many of you come from local communities that are working at DEC efforts, and a lot of you have the drug-free community grants. Can you help others? Because I get it, and Helen gets it, but help make that connection, because I've got some text already saying, so what is the connection? The connection, like Helen Hernandez has said, is obvious. From our perspective, what can we do to help you guys make that intersection? Does anybody have any questions about that?
Hey, Eric, this is Laurel Muting. I'm the prevention director at Heartland Family Service. I guess I'm confused. What is the question? We are a DEC coalition that just got a brand new year one DFC. So is that, that's what you're looking for? Like, every DEC coalition could apply for DFC grants. That's it. That's all you need to know. Do it. It's a good thing.
Laurel, that's exactly what I wanted. Laurel was not one of them I was texted, just so you know. But Laurel, that's exactly what I want. It's just a good thing, right? It's a natural fit. And I think others need to hear that, though.
I've been in prevention a long time, nearly 19 years. And so I've been part of different community coalitions that have had DFCs. So, yeah, I've been around a long time, and DFC is one of the best funding sources that I've ever been a part of. We have state funding, and the DFC federal funding is just way better. Like she said, local communities know how to solve local problems best. And so thanks for continuing to support that, Helen, because that's just really great. There's not so many restrictions, and you're allowed to do what you need to do for your communities. So
Laurel, you are spot on. Thank you. That's kind of what I was looking for, is it's that obvious. So thank you.
It's that obvious, but for some reason, right? Like we've not been engaging as much as we can, or maybe our DFCs don't know about DEC. And so that's, something else I'm interested in. How do we help me understand kind of where those gaps are so that we can continue to amplify our efforts? Because again, our missions exist. And so Laurel, you are a DEC coalition, but you are also a DFC, and that's great. We should have more of those.
And I wonder too, sorry, you asked for audience participation. I don't sit well without sharing. But I think a lot of DFCs traditionally, choose to work on alcohol, tobacco, vaping, things like that. And while most of us in the DEC arena know that alcohol is a problem and endangers kids, I wonder if there are some, like for us, our DFC, we're working on marijuana and methamphetamine. I think those traditionally go more hand in hand with DEC coalitions and what people are working on with their drug and endangered children's teams. And so I'm just wondering if that's part of the disconnect. We've always had, meth and marijuana in our work plans over the years, but I don't know if that's maybe part of it. We don't put alcohol in our DFC work plan because we have other dollars that fund that.
I think that's an excellent point. And so so for the national cross-site evaluation of our DFC program, we will require everybody to submit data on alcohol, tobacco, marijuana, and prescription drugs. And I know you all know why, right? Those are the most easily accessible to our young people. Again, we're focused on middle school and high school age kids. However, local problems require local solutions, and we want through the DFC program that our community coalitions be data driven. And so although you're required to collect data on alcohol, tobacco, marijuana, and prescription drugs, community coalitions applying to the DFC program are able to identify what the needs are in their community. If it's not alcohol, if it's not tobacco, if it's not marijuana and not prescription drugs, then tell us, what is it? As long as you have the data to back it up and you can support it in your application, which is again a competitive process, then that's fine. If it's meth and something else, great. We want you to focus and be data driven, and to have your local needs assessment completed, and that you have an understanding of what those local conditions are. If you do, then an application for the most part will score well. So I think that's a good point, Aurel. I think that's really helpful to, at least for me, right, as I'm learning a little bit more about the work you all do. That's helpful, and I think that's an important distinction.
And Helen, that's another point of intersection between DEC and DFCs, is we meet communities where they are and help them address those local community issues with the resources that are available within that community, so it's sustainable. And you use the word sustainable a couple times, and that's obviously a big focus of ours, is helping DEC alliances and be sustainable as well. And it could be too that we need to all recognize that we could call it an alliance, a coalition, a multidisciplinary team. We mean the same thing.
Yeah.
And occasionally language can separate us, but in this case, I think it's a good opportunity for a language to bring us together.
You're exactly right. That's something that we've been trying to do a little bit of better job at within the DFC program, because when we conduct these trainings and these briefings, we say coalitions. But people, I don't think, see themselves as a coalition, or they have a different definition of what a coalition is. So, task force, partnership, committee, work group, whatever it is you call yourself, as long as you meet these, requirements, you have 12 sectors represented in your task force, your committee, your team, that's a coalition in our books. There's no reason why you shouldn't, apply.
I love this. Thanks, Helen. I just wanted people to see that connection, because we see it, like you said. And Laurel, that was very helpful. And you gave Boots experience, and you've been doing great work with DEC stuff in your community and been in prevention a long time. So that was my question, just to try to instigate some conversation. Now I'll mute myself again for everybody.
No need to mute yourself, Eric. What other questions are there? The statutory requirements are, they're embedded into the DFC program. And so in order to apply, this is the first step, meeting these statutory eligibility requirements. So it's not a grant in which you're awarded the grant and then you start collecting your 12 sectors. 12 sectors have to be on board at the time of application. Your community coalition has to be in existence for at least 6 months. Your community coalition, your task force, your work group, your team, your committee, whatever you call yourselves, you have to be in existence for at least 6 months. And you'll want to make sure that when providing the information to prove, the documentation to prove that statutory requirement, we typically ask for a set of meeting minutes. So you would be providing meeting minutes where you have some of these 12 sectors representative, and you're discussing some of the important work that you're doing in your communities, right? 6 months existence means that our community coalitions that are interested in applying for fiscal year 24 have to be created now, like November, December timeframe. Now is the time that you have to be, working as a coalition. So the timing of this briefing could not be better. Your mission statement for the DFC program is going to have to be the coalition's mission statement, and it will have to be the prevention, reduction of youth substance use. That has to be the sole focus of what this group is working on in order to be eligible to apply to the DFC dollars. So it's got to have those words. You've got to be addressing multiple drugs, okay? So the DFC program statute require that our community coalitions work on towards 2 substances: alcohol and tobacco, marijuana, prescription drugs, meth, you know, whatever it is. It has to be 2 substances. And I always say this as part of my application training, not a TOD. So you cannot, under any circumstances, if you want to score well, mention within your application your focus on alcohol, tobacco, and other drugs. Because what that tells a peer reviewer is that you don't know what the local issues are. You're just generalizing. You've got to be specific within your application. The National Cross-Site Evaluation statutory requirement is very simple. You are going to participate in the National Cross-Site Evaluation, and you've just got to be okay with that. You've got to be, of course, an eligible entity to receive federal dollars. That means you either have to be a 501c3 and applying on your own behalf to administer and manage these grant funds. And if you're not, right, we don't want to leave those community coalitions that aren't 501c3s out to dry. We want our community coalitions to then, we've allowed for some sort of partnership with an entity that's going to serve as the fiduciary, that's going to serve as a fiscal agent. I mentioned this earlier, but in those situations, it's critical that our community coalitions and their fiscal agents understand the roles and responsibilities of what it means to be the coalition, because the funding is being awarded to the fiduciary, the fiscal agent, but the work is going to be conducted by the coalition. And so there are instances where those relationships go sour and things happen. So it's important to have a good, strong relationship and partnership and kind of lay of the lands, establish those rules or those responsibilities and those boundaries ahead of time. Match from non-federal sources is one as a year 1, let's say, coalition, and even as a year 6, if you're applying for a new grant, you're going to be required to meet that 1-to-1 match. If you're requesting the full 125 from the DFC program, you would be matching 125 from non-federal sources. Many of our community coalitions are meeting that match requirement through their sector representatives' time on the coalition. So if you have someone who's serving as your accountant, volunteering to serve as your accountant, that accountant's time counts towards your match. Or your space, donated space for events, or equipment, paper, copiers, printers, anything that's donated could count towards that space. So again, it's I know it can be a little bit concerning to commit to meeting that match requirement, but it's not as hard as you might think. We just got to be a little bit creative. The limited to 125 per year. I always say this as a preventionist, as a community mobilizer. We are good at making people do things that they maybe didn't want to do. And maybe the accounting piece we're not so good at. And so anywhere in your application under the federal request, it has to say 125. You can't go over. So make sure all your calculations in the application process add up to the full 125. And I want you to request the full 125. You can ask for less, but I prefer you take it off. Zip code overlap is one that I think sometimes gets people a little hung up on. But we want our community coalitions to not overlap zip codes. We don't want to duplicate efforts. So it's important that our community coalitions, if they're going to be working on, let's say, zip code 33012, and we have 2 or 3 coalitions working in that same zip code, that we divide and conquer, right? That you all come up with a plan on how you're going to collaborate on that one zip code. I'm going to do the north, you're going to do the south, and I'm going to do, the southwest. Like, come up with what the natural delineations are in your community to break up that zip code so that we can be effective at addressing, the entire area. And then lastly, that's no more than 10 years of DFC funding. This is one that I think folks can sometimes struggle with. As far as the statutory requirement is concerned, it's easy. It's a piece of paper you fill out and you say you understand that you're not going to be funded for more than 10 years because that's all I'm able to, fund a community coalition for. But I think folks, after getting to year 10, get a little creative and try to, change a few things and then try to reapply. So you don't want to do that. 10 years of DFC funding, and that's it, right? You hopefully in those 10 years, we have supported you and provided you the training, the resources, and you've mobilized your community so that you can be sustainable on your own. That is a very quick overview of those statutory requirements. And again, on that website that's on the screen that I'm happy to share with you all, you'll see the resources that are available. Again, these are for fiscal year 23. But if again, these are things that you can start getting to work on like now. In preparation for that, NOFO, that again, late January and more likely early February this year.
Helen, that is terrific. And I really appreciated the discussion about bringing our parallel tracks to a point of intersection. And so we're obviously going to be having more conversation about that. And so the next time we present together, we can present a plan to the group is my hope. Does anybody have any additional questions? I want to make sure I'm being considerate of Helen's time. She's got a crazy day today, and she shared
double, triple booked all day.
She's been crazy. There's just nothing going on at the White House that would keep everybody so busy. I can't imagine what it could be. But are there any other questions for Helen? I put some links up in the chat, Helen, with links to about the drug-free communities and the index of those, and I'll put a couple other links in, and then we'll share your slides as I'll put them in a PDF and share them with folks as well. We record this, and so it's going to go up on our YouTube channel. So we'll have folks continue to view this over the next months, and so hopefully we'll get some more interaction from that information. But I wanted to thank Helen for her time today. We really appreciate the ongoing conversation and what you shared. Great seeds to plant regarding how we can come alongside, and our DEC alliances or coalitions could come alongside and seek those DFC funds to continue all those efforts. Is there any other final question for Helen before we let her get to her third thing that she'd be doing right now?
Well, I truly appreciate the opportunity to speak with you all. And, I'm happy to brief you on the DFC program. I'm happy to engage with you on a more regular basis if that's helpful to you all. But what would be helpful to me is to hear from you on kind of ideas, gaps, things that we can, we've not thought of that we need to. In order to not only amplify the DFC program in communities across the country that need it, but also opportunities in which we can be supportive to the work that you're doing, because clearly our missions do align quite nicely. So I appreciate, and again, open to all the feedback you all might have. Scott knows how to reach me, so, just send them to him. He'll send them to me.
Yeah, I'll batch them so that you don't have to answer 50 emails. You can do one or two. And the data information, Helen, is one of the things that it planted some seeds in my brain. So I'll do some follow up on that, because we're all seeking data that we can share in our communities, and there's a lot of data overlap. And so how we can contribute to that data, and also how we can share the data appropriately, something that I'd like to talk about as well.
We have our national cross-site evaluation posted on our website. So if you went to whitehouse.gov/ONDCP, so Office of National Drug Control Policy, you can find on there the DFC program, and there's a tab called Impact. And we have an infographic, and we also have our latest findings from the cross-site evaluation that we just published, I think August of this year. And so take a look at it. That, to me, it's a lengthy read, but it is a really good resource if you're trying to better understand, okay, so there's these things called DFCs, and they're in communities, and our missions align. What exactly are they working on? I think this document, the National Cross-Site Evaluation, would probably give you a more in-depth conversation or a discussion on what the DFCs are actually doing on the ground.
Great, and Carrie and I were on the same page. We both just posted the link to the website in the chat.
Wonderful.
Well, Helen, thank you so much for being with us this afternoon, and I appreciate the conversation, and I appreciate everything that you're doing in the prevention world, and we're proud to be there with you.
Thank you. I appreciate the work you all are doing, and thanks for having me.
Thanks.
Have a good rest of your day.
You too.
Bye-bye.
Well, that is everything that we had today for our all hands on deck call. So thank you all for joining us and being here, and we'll look forward to seeing you in 2024. Have a good rest of your day.
Thank you.